Okay, so I hope everyone can see the presentation and can listen to me so that I can start the presentation. Okay, so PopQ, this is a very famous topic for FCPS students as well as MRCUG3 students. In MRCUG3, you don't need to know a lot about PopQ, you just need to know about the grid. Because in few past exams, like in the previous attempt, my attempt as well, in the previous November attempt as well, the PopQ came as a teaching station. So it is an important station for MRCUG students to learn it, and it is also important for FCPS students as well. So I will be explaining about how we stage it and how what the grid means and what are the points on PopQ. Apparently, it may seem like a very horrible topic to every one of you, but I hope by the end of presentation, I'll be able to make it easier for you because the concepts of PopQ are not very difficult. It's a very easy topic if you understand it. So I have made a lot of handwritten, like I have made a lot of drawings for you people in this presentation so that I'll be able to explain it in a better way. So let's start with the PopQ classification. First of all, every one of you knows that this is basically an international method of categorization because there are a lot of methods of grading the prolapse. So it is, you can say that it is an international method and it is worldwide accepted method by which we can grade or we can quantify prolapse. Okay, so there is one request to everyone that please keep the mics mute because this will cause less disruption and my voice will be more clear to every one of you. Now comes, what are the objectives of PopQ? All of us know that we need it for the quantification of a prolapse, basically. So also we can compare some surgical outcomes if we are going to planning for a surgery for prolapse, and we can see that whether the prolapse before surgery, what was the stage before surgery, what was the stage after surgery. So the main objective you can say is the quantification of the prolapse, and we all know that. So after that comes some prerequisites. So what are a few things that we should be careful about before checking a woman or before examining a woman or quantifying her on PopQ quantification system? First of all, the rectum and the bladder should be empty, and then the position of the patient should be in such a way that because when a patient will come to you in your OPD, the patient will tell you that when I sit in that position, the prolapse is maximum. When I stand, when I strain, the prolapse is maximum. So look at the prolapse. You have to be careful about them, and it is a good practice that you examine the patient in the same position in which the prolapse is maximum. It can be supine, it can be standing, it can be birthing chair at 45 degrees. I have mentioned a few. So generally, we can quantify it without a sim speculum, but sometimes if it is not outside the hymen, we might need to carry out a sim speculum examination as well. And for every procedure, the consent is very important. So these are a few prerequisites in which you need to remember the most important ones, that you have to empty the bladder and the rectum of the patient, and the position in which the magnitude of the prolapse is maximum, that is told by the patient to you in the history. The patient should be examined in that position, whether it is squatting, whether it is supine, whether it is standing, whatever position the patient mentions that when I sit in that position, the prolapse comes out its maximum. So you can examine her in that position, but it should be comfortable for patient. So these are a few prerequisites. Now coming to the prolapse itself. So there are let me tell you that what is the parameter for measuring. It is basically the hymen. So hymen is defined as 0, and usually we measure in centimeters. So whatever numbers are proximal, you can say that whatever numbers are proximal, these numbers are basically the negative numbers, and those that are distal to the hymen, they are positive numbers. Or if I simply mention it for you, the points, if the any part of the prolapse is behind the hymen or it has not come out of the hymen, then it is a negative number. And if the prolapse comes out of the hymen, then it becomes a positive number. So we all know that. And we have different positions that are AA, BA, C, D, AP, and BP. And I'm going to explain it to you in a while as well. Okay, so I hope everyone is clear about what is the parameter of measurement. It is the hymen that is the reference point, and all the points that are behind hymen, or you can say proximal to hymen, are negative numbers, and all the numbers that are distal to hymen, or you can say outside the hymen, they are positive numbers for prolapse. So there are different grading systems. In the anterior compartment, we have these points. I will be showing you a diagram in a while. And in posterior compartments, there are these points. And there are some other landmarks as well. I'm going to show you so that you can understand it in a better way. Okay, so here you can see the diagram. So this one is, this is the uterus, the cervix, and this is the anterior wall, which is labeled by small a. And the posterior wall is labeled by a small p. So this one is the anterior wall, and this one is the posterior wall. I will be showing you external urethral meters and other points in the coming slides as well, so don't get confused by them. But you can say that external urethral meter starts from here to here. I'm giving you a rough idea. I'll be showing in more detail in coming slides. So you can say that the first 3 centimeter, after first 3 centimeters from, everyone, can you please mute the mics? Okay. Okay. So this is the anterior wall, and anterior wall has 2 points. One is AA and one is BA. So you can say that the proximal portion, this is the proximal port 3 centimeters. This is called as AA. And the posterior wall, the same proximal, 3 centimeter proximal to hymen, it's called as AP points. This point is basically called AP, not this whole distance. Only this point is called AP, and this point is called AA. On anterior wall, the after 3 centimeters or proximal to hymen 3 centimeters is called the point AA, and on the posterior wall, this point is called as AP. So if we come to the definition, AA means that it is 3 centimeter proximal to external urethral meatus on the anterior vaginal wall. The external urethral meatus is here. Can you see my arrow? External urethral meatus is here. So 3 centimeter proximal to external urethral meatus means this point. And 3 centimeter proximal to hymen posterior vaginal wall means here the hymen lies here, and 3 centimeter proximal to it lies here. So this is AA and this is AP. So this is the A point, and the most distal part on anterior, this is the anterior vaginal wall. So this the distal portion, this is the distal portion, this one. So this portion is marked as BA and this portion is marked as BP. Basically AA, BA, they are the same, and this is, if this is hymen, so I told you that whatever is inside the hymen and has not come out is a negative point, and whatever comes out of hymen, it is a positive point. So this is hymen, and this point is 3 centimeter behind the hymen, so it means it is -3. Similar way, this is -3. BA is also -3 and BP is also -3. Basically, these distances are almost equal. So this is these are basically the points, and for point C is cervix and D is the posterior fornix. This you can say is the anterior fornix. Sometimes if a patient is hysterectomized, then there is no point D, there is only point C. So these are a few points that you need to remember. Before going further, if anyone is having any query or any question about these points, just let me know so that I can clarify it there and then so that we can move forward. You can drop me in the chat box if anyone is having any query. Okay, I hope everyone is clear about this grading system up till now. So after these points, we are coming to the next part. It's just the explanation of these parts that I'll be explaining it to you. Okay, so I have a question here. Okay, Shaista says she's clear. Thank you, Shaista. Okay, so as I told you that whenever it is a hysterectomized patient, there is no point D, it is only point C. So this is the diagram of a hysterectomized patient. Okay, so coming forward, okay. Okay, so I'm going to explain each point for you in somewhat more detail. Now, you should keep this figure in mind. Keep this figure in mind while I'm explaining all the points one by one so that it is more clear for you. So first of all, we have point AA. So point A is basically in the midline of anterior vaginal wall. And if there is no prolapse, this location is 3 centimeter up from the hymen. You know this position is 3 centimeter up from the hymen, this point AA. Okay. So parameters of the hymen can be -3. So the normal position I told you, AA is -3 is the normal value of AA. And if the prolapse is outside, then it means it is +3 is a full prolapse, which means that if suppose this is the point, if this point of the anterior vaginal wall comes out this much, like 3 centimeter, this means it's a full prolapse for the anterior vaginal wall. I'm not talking about the prolapse of uterus, because the uterus can prolapse up to 8 centimeter as well. But I'm talking only about point AA. If this point, this anterior wall's point comes out to be 3 centimeter, it is a whole prolapse of +3. So I hope this point is clear to everyone. So I hope every one of you knows. Okay, so we were on point AA that I was explaining it to you. I hope AA is clear to everyone. If anyone is having any doubts about the point AA here, just let me know. It is just remember, it is just this point on the anterior wall that is called as AA. And and its normal value is -3, which means 3 centimeter behind the hymen. So when there is no prolapse, the location is 3 centimeter up from the hymen or 3 centimeter behind the hymen, you can say for in easy terms. Okay, so then comes the point BA. You know what was BA? This was BA. Let me show it again, please. Okay, so the BA refers to the most distal portion of the remaining anterior side of the, just give me a minute. Okay, so what is meant by BA? You know that it was the most distal portion of the remaining upper anterior wall, and its point was also -3. Where there is no prolapse, this point is -3 usually. So this means that when the woman is having a full prolapse, it can coexist with point C. Well, this thing means that, this is the point BA. Let me show it to you. Okay, so this is the point BA. So you can see that point BA is basically the most distal point of the anterior vagina, or of the if this is 3 centimeter, this total is almost 8 centimeters, 7 to 8 centimeters, and the posterior wall is almost 10 centimeters. So BA is basically the point that is most distal on the anterior abdominal, anterior vaginal wall. Okay, so let's come to the point BP. Basically, BP means that it is the most distal portion of the upper posterior wall. You know that I showed you point BP. It was on the posterior wall. And about point AP, it is basically the posterior point. Basically, the point that is 3 centimeter proximal to hymen is called as AP. And when you talk about the distal portion of the remaining upper posterior side of the vaginal wall, it is the point BP. Let me show the diagrams again so that you are very clear about it. This is the point AA. This is the point BA. So AA is basically 3 centimeter behind hymen. This point is called as AA. And this is the remaining anterior vaginal wall. So the most distal portion of this remaining anterior vaginal wall is BA. This point is BA as well as this point is AA. But AA represents that if this is the hymen, 3 centimeter behind the hymen is the point AA. And if we talk about the remaining anterior vaginal wall, then the most distal point of the remaining anterior vaginal wall is called as BA. Similarly goes for AP and BP, but in terms of posterior vaginal wall. So in posterior vaginal wall, if this is the hymen is at this point, 3 centimeter behind it is the point AP, and the remaining portion of the posterior vaginal wall, the most distal portion of the remaining portion is called as BP. But see, when this point will prolapse out, this can be +3, this can be +7 as well. But we learned about the point AA that only it can be +3 or it can be -3, it cannot be more than that. C can prolapse behind as well, like it can be a procedentia when the point C is outside. When the point C is outside. So this is basically a hysterectomized patient and this is a normal patient. So I hope everyone is very clear about the positions AA, BA, AP and BP. And I told you the normal value for all of these is -3. This will help you in understanding the grid. Is anyone having any problems about these points? Yes, Chido. Basically, what I meant by remaining was, see, first 3 centimeters is called as, after first 3 centimeter, the point comes AA. So this is the, like you can say that this is the first portion of the vagina. If we divide the vagina into two parts, interior vaginal wall into two parts, this is one part and this is second part. So 3 centimeter behind hymen is the point that we call as AA. And this is the remaining part of cervix, which means that if the total anterior length is 7 centimeters, this is 3 centimeters, and this is 4 to 5 centimeters. So amongst this 4 to 5 centimeter, the most distal portion of this part is called as BA. Okay, I hope you got it. Chido, did you get it?
Yes, I got it, but I'm wondering, in the teaching station, then won't my student or my SC1 be confused?
Chido, I
It's
cannot
like
understand you. Can you
many
type it?
words.
Your voice is not very
No,
clear. Can you type it, please? I will answer that. Just type it and let me answer that.
okay,
Yes, please.
okay.
Okay, so let me make it somewhat more easier for you. So you can say that this is the anterior vaginal wall, this is the upper portion, and this is the lower portion. Okay, so the lower 3 centimeter after the hymen, this is point A, and this is the upper portion of the anterior vaginal wall. So the most distal part of the upper part of the anterior vaginal wall is called as BA. So when we go this like when we go in this direction, this is called as distal, and when we go in upward direction, this is called as proximal. So this is the upper part of the anterior vaginal wall, and the most distal part of the upper vaginal wall is called as BA. That is what I mean.
Okay, got you.
Okay. So if anyone else is having a problem, just let me know so we can move forward. Okay, so these are basically the points AA, BA, AP, BP, and point C, as I told you, that it is basically the lowest edge of the cervix. And if it is a hysterectomy patient, then point C means that it is the lowest portion of the vaginal cuff. And the point C is basically the cervical descent or the uterine descent that we usually see, like uterine prolapse patients. We can see that point C is protruding outwards, or point C is basically prolapsed. I'm going to tell you that what cystocele means, what enterocele means, what the vaginal prolapse means in this presentation. Okay, so the point D is basically the posterior vaginal wall, and so this is basically it. Let me show you once again to so that everyone is clear about the positions. So let's say this is the hymen. So 3 centimeter proximal to it, we call the point that is called as AA. This is the, you can say, the lower portion of the anterior vaginal wall, and this is the upper portion of anterior vaginal wall. So when we talk about point AA, it means that if this is hymen, 3 centimeter behind the hymen or 3 centimeter proximal to hymen, we have a point that we call as AA. And when we talk about the upper portion of the anterior vaginal wall, the most distal portion of the upper vaginal wall is called as BA. Similarly goes with BP and AP, but in terms of posterior vaginal wall. The point C is called as cervix, and point D is the posterior fornix. And all of you know that posterior fornix is usually more deep than the cervix. So the point D is almost 10 centimeter away from the hymen. So it is usually minus 10. It's like if I give you a value, it's minus 10. I'm going to describe the values for every one of them. I'm going to take it stepwise so that it's not difficult for any one of you. Okay, so these were the points that I hope that everyone is clear about these points, because now we are going to talk about the three more landmarks for you. So I told you that this one I told you was the external urethral meatus. So there are three terms that we are going to learn here. One is the genital hiatus, one is the perineal body, and one is the total vaginal length. So what is meant by genital hiatus? It means that this is basically the external urethral meatus. So the midpoint of external urethral meatus to the posterior part of hymen. This is called as genital hiatus. And this portion from the posterior portion of hymen to the middle of the anus is called as perineal body. Let me show you. Okay, so here you can see that this is the puborectalis. You all are aware of the anatomy very well. This is the levator ani, this is the puborectalis. So you can see that this is the opening for anus and this is the opening for urethra. So this opening basically correlates with the genital hiatus. Okay, I hope you are getting it. And this one correlates with the perineal body. So whenever there is any laxity in these muscles of the levator and eye, these diameters do increase. I hope I'm clear about it. So this portion from the middle portion of the external urethral meatus to the posterior part of hymen is called the genital hiatus, and from the posterior part of hymen to the middle point of anus is called as perineal body. Okay. So apart from that, we have another thing that is called as total vaginal length. This starts from the hymen to the posterior fornix. So you can, every one of you can well understand by the term itself that the total vaginal length means the total length of vagina, which is from the hymen to the posterior fornix. Is everyone clear about the genital hiatus, perineal body, and total vaginal length? Or should I explain it more? Okay, so by the silence, I am assuming that everyone has got that. Okay, so let's study a bit. Genital hiatus, it is basically the length from the urethral opening, external urethral meatus or the urethral opening to the posterior vaginal opening or hymen. Okay, so it is basically an opening in the puborectalis muscle. And if the distance is larger, this may indicate that there is laxity. So location can range from -3 to +6 or +7. This is not that important for you, but the most important thing is that if we look at the puborectalis and if we look at this portion, so we have to see that these two portions. So this is basically the perineal body, and this is basically the genital hiatus. So whenever the distances will increase, this will mean that there is some laxity. Okay, so the portion that is just below the sacrum, this is going to be perineal body, and this one is going to be genital hiatus. Sorry, this is going to be genital hiatus, and this is going to be perineal body. Okay, so here we have genital hiatus, and the perineal body is basically again an opening in puborectalis, and the large distance means that there is laxity in this area. I hope everyone is clear about these: genital hiatus, perineal body, and the total vaginal length. Genital hiatus, perineal body, and the total vaginal length. So this is it. Okay. Okay. Thank you, Sarah. Okay. So going forward, okay. So now I'm going to tell you that, so this is again another diagram in which it is showing that this is the genital hiatus. You can see that this is the urethra, the point from the mid portion of urethra to the back side of the vaginal wall or the posterior part of the vaginal wall. This is genital hiatus, and from here to the mid of the anus is called as perineal body. This is AA, this is BA, this is C, and these all are shown as I've already told you. Okay, so now I'm going to be discussing that what are the total diameters of each of these, because they will be really helpful to you when we are going to make a grid. So you can see that now the planes have changed, but this is the urethra, this is the vagina, and this is the anus. So here I have marked the mid portion of urethra to hymen like genital hiatus and the perineal body. So now we can see that anterior vaginal wall is almost 7 to 8 centimeters, as I already told you, and posterior is almost 10 centimeters. And point AA and AA is almost 3 centimeter proximal to hymen, this, and the length that is left behind is 5 centimeters. Similarly, 3 centimeter and 7 centimeter. So here are the normal values: AA minus 3, BA minus 3, AP minus 3, BP minus 3. Okay, so let me tell you here that when we talk about BA, any point behind this is a normal point. Like if it is minus 3, it is normal. If it is minus 4, it is normal. Any point from minus 3 to minus 8 is considered normal. And in posterior wall, any point from minus 3 to minus 8 is normal, because if anything is behind this point, it is normal. But if something is crossing this point, then it means it is a prolapse. The cervix is minus 8, the like the posterior fornix is minus 10, the genital hiatus is minus 2, and the perineal body is minus 3. So we need to know these three things. First thing is, what is the leading point of prolapse, from which area it comes, and what is the distance from hymen. Let me explain you on the diagram I made. So you can say that this is the point AA normally, but this is the portion. Here it has prolapsed like this. So now this leading point is AA. Now we see from which area it is coming. We know that it is coming from the anterior wall. And now we will calculate the distance from the hymen. This is hymen, so how much is the distance? So this is how we calculate the POPQ grading system. Well, Nova, they are considered as like the genital hiatus and perineal body. They will never be used in they will never come as a positive value to you in exam. But generally, they are considered as negative values. Like they are not inside the vagina, but their values that are given are normal negative values. Well, Sarah, the points C and D are not fixed. They vary according to the length of the vagina. But overall, it is considered that the posterior fornix is usually 10 centimeters, but sometimes it can be 8 as well. So these are not fixed. They can vary from person to person. Normally, the anterior wall is almost 7 to 8 centimeters and the posterior is 10, but the range is 7 to 8 and 8 to 10 as well. Okay. So let's learn about the grid. Okay, so this is the grid. You need to learn about the grid. Okay, so I told you a very simple rule that whatever is behind the hymen or that is proximal to hymen, that has a negative value, and anything that is distal to the hymen or outside the hymen has a positive value. Okay, so this is a simple rule. This is the grid that we need to remember. First of all, the anterior wall, AA, BA, cervix, then the genital hiatus, perineal body, total vaginal length, then the posterior wall, and then the posterior fornix. So this is the arrangement of the grid. And I already told you the normal values, the AA minus 3, BA minus 3, AP minus 3, BP minus 3, cervix minus 8 because it is behind the hymen, posterior fornix, it is behind the hymen, this is 0, this is minus 3, this is minus 8, this is minus 10. Okay. About the genital hiatus and perineal body, they are given the value negative values. Noha, they are just given the negative values. It's not that they are behind the hymen, that's why they are given negative values. But whenever we talk about their values in a grid, they are negative values. And there is no specific reason for that. It is basically the grading only. And whenever you will see the grid for part 2 FCPS or for part 3 Mrcog, you will never see the genital hiatus and perineal body as to interpret. You basically have to interpret these three and these three for these exams. These two are not to be interpreted in these exams, and they also do not show any kind of prolapse. So they are not important for you in that aspect that negative or positive will change something. So these two are just the values they have given, -2 and -3. And total vaginal length does vary, like it can be 10, it can be 8, depending from person to person. So these are the few things that are important for you: AA, BA, C, AP, BP, and D, because they will tell you that which compartment has prolapsed and how much it has prolapsed. Okay, so now I have shown the values in the form of a grade. We know that AA has a -3 value, BA has a -3 value, cervix has normally a -8 value. Here AP has a -3 value, BP I told you has a -3 value, and D has a -10 value. So this is a normal grade. Is anyone having any questions up till now? I'm open to questions anytime. Okay, so I hope everyone is clear about it. Okay, so I have made a few more diagrams for you. Let's see case number 1. So this is case number 1, and this is a normal grid. And just by seeing it, you can simply tell that AA has prolapsed because the value is +1. We know that the normal value is -3. So this means that the point AA is +1, means it is 1 centimeter outside the hymen. This is +1. So here I have to tell you an important concept as well. This is basically showing the, you can say the lower portion of the anterior wall is showing urethra, the upper portion is showing the bladder, and the posterior wall is showing the rectum, and this portion is showing the cervix and the uterus. So when we talk about AA and the AA has prolapsed, this means that the urethra has prolapsed. Okay, so this means that AA is prolapsed +1. This means that it is a urethrocoele. I hope I'm clear about it. So when we talk about the B point, BA is prolapsed. See here, all the grade is normal, but BA is +2. This means that the anterior, the anterior wall, the upper anterior wall is basically the bladder. So when BA is prolapsed and we say it is +2, this means that it is 2 centimeter outside the hymen. So this means that it is a cystocele, it is the bladder. This portion is the urethra and this portion is the bladder, and posteriorly it is only rectum. Is everyone clear about urethrocoele and cystocele? That how we see on the grid? I'm just
Yes, ma'am.
hoping that by the end of the presentation, everyone is just clear about the grid, that whenever they see a grid, they can interpret it that what it is, whether it is a urethrocoele, whether it is a uterine prolapse, or whether it is a cystocele, they should be very clear about it. So whenever any point like A is prolapsed, you clearly know that it is a urethrocoele. And whenever point is prolapsed, you can see here, you are clear that it is a cystocele. Thank you so much, Ido. Thank you, Noha. Okay, so I am happy that my students are getting it, because PopQ is not difficult. It's just that if it is made simple, I am really hopeful that by the end of the presentation, I'll be able to make it clear for every one of you, so that PopQ is no more a very big problem, or it's no more I used to be very scared of PopQ, but once I understood it, now it's really easy for me. So I'm aiming the same for my students as well. So well, I was supposed to hide these for you to interpret, but now I have written them. So you can see here, A is normal, BA is normal, C is normal, BP is normal, D is normal. Okay, so what's the problem here? It is basically AP. So what it means, it is a posterior wall prolapse. So what do we call it? What is it? Okay, so this is,
Rectocele.
yes, exactly. So this is basically a rectocele. And we know that it is 2 centimeter behind, like 2 centimeter outside the hymen, so it is +2. So this is how you are going to grade it. Now I'm coming to the most favorite part of the exam, that is the cervix and the posterior fornix. You can see that whenever there is a prolapse of the uterus, whenever there is a uterine prolapse, then this means that the usually the posterior fornix or the D point is also changed, because the uterus is moving forward. So here you can see that we know that -8 is a normal value. So 0 means that it is itself a prolapse. It's not that only positive values are a prolapse, but any deviation from the normal is a prolapse itself. So here you can see cervix is 0, so it is also a prolapse. I'm going to tell you that how we grade it. So here you can see that this is a complete prolapse because all of the cervix is outside and it is +10. The D is +10 as well. So this is the procidentia. So I hope everyone is clear about all the 5 cases. I have basically made all the 5 cases that can be possibly coming in the exam or that can come for the interpretation. You just need to remember the normal values of the grid. So here, okay, so stages, let's do the staging of the POPQ. Let's make it easier. Okay, so this is the hymen. I'm just going to explain it like the presentation is left, only 5 minutes are left because this is the final thing we are going to do. This is basically the hymen. So anything, if anything is within 1 centimeter proximal or distal to the hymen, it is a second degree prolapse, which means that 1 centimeter above or 1 centimeter below, this bulge is second degree. If the bulge is more than 1 centimeter away, it is first degree. And if it is more than you can say if it is more than 1 centimeter bulging outside, then it is called as third degree. And if it is a complete prolapse, we call it as TVL -2, which means almost 8 centimeter or more. So more than 8 centimeter is called as a complete prolapse. I have made it very simple for you. These terms might be a bit difficult for you, but if you remember this diagram, that's it. Which means that if you fall within 1 centimeter above or 1 centimeter below the hymen, you can see 1 centimeter proximal or 1 centimeter distal to the hymen. Proximal or distal to the hymen, this is a second degree. If it is if it is does not come in 1 centimeter and it is even far behind, then it means it is a first degree. And this means that, and if it is behind the hymen and more than 1 centimeter, it is a third degree, and complete one is fourth degree. So you can see here, what would you call it? What is it? Or which degree is it? Can anyone
Fourth degree. Procidentia.
This one?
Second degree.
This is the hymen. Yes. Who said second degree?
Yes, second degree.
Yes, it is a second degree. Who said that? I'm really happy.
Susan.
Yes, Susan, you interpreted it well because see, this is hymen. Hymen is 0. So if it is within 1 centimeter proximal or 1 centimeter distal to hymen, it falls in second degree. Like if it was behind this point, it would have been first degree, but within this point and this point, like 1 centimeter proximal and 1 centimeter distal, comes in second degree. This, let me tell you.
I have one question, ma'am.
Yes, please.
If C is 80, it means this is second degree prolapse.
Sorry, what did you say?
If C means cervix is 80, 8 hymen, then it would be like second degree prolapse.
80, I didn't get 80.
Ma'am,
Oh.
you can see this in the second picture because as Susan told, this is the second degree prolapse. So the grid shows if the C is at 0, it means this is same like second degree prolapse.
Yes, exactly. If C means 0, this means that this point is at hymen. Okay, so if it was
Yes.
like, so this is at hymen, and when it is at hymen, then we call it as like anything in between this point is called as second degree, which means that it can come behind hymen 1 centimeter behind hymen or 1 centimeter outside hymen. Anything that comes in this is called as a second degree, and we can see that this is at point 0. So 0, here -1, and here +1. +1, 0, -1. All of these come in second degree. Okay. Did you get that?
Hi. So
Yes.
are we using degree and stage interchangeably? Sorry for taking you back.
No problem about that. Okay, so Chido wants to ask that degrees and stages are interchangeable. Well, no, they are not interchangeable because this classification, this has been taken from the RCOG guideline, you know that. So this is not basically this cannot be interchanged. I'm not getting it interchanged in what sense, Chido?
Because on your diagram you say stage 0, but when you are talking, you're saying first, you say stage 1 minus 1, 2 plus 1 is stage 1. That's what your diagram is showing. But when you are explaining, you're using the first degree, second degree.
Okay, so I'm getting it. What is the problem here? Let me explain it, Chido. So
Yep.
actually, to talk about the grid, we are basically talking about at what position the cervix is. This is what the position is. This is not the staging of it. This is just a grid that is showing that what is the position of the prolapse. So when the
Oh, okay.
position will be 0, or when it will be +1, or when it will be -1. When will the C will be 0, +1, or -1, it will be a
Mm.
second degree prolapse. Okay.
Okay. Which is
Okay.
also
So
stage
what
2, right?
about if it is +2? What about if it is +2? What about if C is +2?
Then it's stage 3.
Then it is stage 3, right?
Yeah, but is stage 3, can I also call it third degree then?
Sorry?
That's my question. Can I call it stage 3 or third degree? Like,
Yes, you can call
do
it
they
third
mean the
degree.
same thing?
You can, they are
Also, I
the
can
same
say
thing.
stage 3 or third degree.
Yeah, they are the same thing basically. The staging and the degrees
Okay,
are the
fine.
same thing. But in the RCOG
That's my
guideline, if we
question.
talk about that, they have mentioned the stages. So okay,
Okay,
so
fine.
this part was confusing. I'm happy to do that you bring it up because I think the students were confused about that. So I'm really thankful to you that you bring it up, and I hope the students are clear about that. Okay, so just tell me that if it is -3, what is it? Which degree is it? Can anyone tell me? If it is -2 or -3 centimeter, which degree is it? Can anyone tell me, please? Come on, students, need some brainstorming. Okay, so if okay, welcome back the students, and I'm really sorry for the disruption. It's just a bad net today. But the good part is that we have almost completed it. It's just a question answer session that is left, and just I have to explain it like the last part a bit more. Apart from that, the things have been explained. So if anyone is having any questions, just let me know so that I can clarify them first and then we can move forward. Okay, we can wait for 2 to 3 minutes so that if anyone wants to join, they can. Okay, so I was explaining the last part of it. So I was asking the students that if we have this grid, just let me take you back. So this is the grid, and I was explaining Chido that whenever it is 0, +1 or -1, it falls in second degree. Like if it is here, here, or here, this means that it is second degree. And if it is behind that, this means it is first degree. And if it is outside that, this means it is a third degree prolapse. So I'm also going to show you one more diagram for further clarification. You can see this diagram that this is the hymen basically. This is if we take it as a hymen. If we take this point as a hymen, the red point is a hymen. So anything that is +1 centimeter above or plus centimeter below the hymen, this is called as stage 2. And behind that is stage number 1. And far away from that, or you can say behind that, is stage number 3, and the complete eversion is stage number 4. And when we talk about stage 4, it is basically the total vaginal length minus 2, which means that if the total vaginal length is going to be 10 centimeter, this means that 8 centimeter, at least 8 centimeter of the uterus is outside, or sometimes it can be 10 as well. So this is when we call it as procedentia, or like a complete prolapse. So this is how we grade it. Now let me ask you a question, that if this grid is present here, it is 0. Currently it is 0. So if I say that it is -2 or -3, then what is the grading, or what is the classification for it? Please answer me in the chat box. I know I have 2 students left, but just answer me in the chat box. Can you guys tell me that if it is -2 or -3, what it is? Let me show you on the other diagram. Okay, so if it is see, -1, +1, 0, they come in second degree. So if it is -2 or -3, they fall in first degree. And if it comes out to be +2, +3, +4, +5, it is a third degree. And if it comes out to be +8 or +10, then it is a fourth degree prolapse, or it is a complete prolapse. Okay, so is anyone having any questions? Just let me know. Okay, so Anam has just joined, so I'm going to explain it for her. Anam, are you Dr. Aisha Anam?
No, Dr. Anam.
Okay. Let me explain it for you, the concept I was just explaining. Okay, so I was explaining that when the prolapse, let me show you the previous diagram, please. Okay, so this one was the diagram I was explaining lastly. So when the cervix, when it is 0, +1 or -1, it means that it is a second degree prolapse. And when it is -2, -3, let me show you here. If it is -2, -3, -4, -5, then this means that it is a first degree one. And if it is after +1, which means +2, +3, +4, then it means it is a third degree prolapse. So this is how you are going to correlate the two things, which means that you are going to correlate the POPQ system, the grid, and the staging itself. So if anyone is having any question, just let me know. Because afterwards we will be taking the questions, and then we'll be ending the session, because the net is really bad and I don't know when it will end back. This is the diagram I was showing you, that if this point is the hymen, anything that is -1 centimeter +1 centimeter, which means inside 1 centimeter inside, or 1 centimeter proximal, or 1 centimeter distal, then it is stage 2. Anything that is behind 1 centimeter, which means -2, -3, -4 on the grid, that is stage 1. Anything that is behind it, that is +1, that +2, after +1, which means +2, +3, +4, they fall in third degree. So this is how we grade it. So is anyone having any confusions about it? Just let me know if there are any confusions about it, so that I can clarify it once more. So I hope I have made it clear for you, but just I was having a bad connection today, so the things went a bit haphazard. But I'll be trying that I compile the 3 videos that I have taken, and I upload on the YouTube channel as well as the Facebook page. So if anyone is having any questions, just let me know. I'll be more than happy to explain it to you again.
Ma'am, just joined. So can you explain quickly the last picture?
Okay, sure, Shaista, I'm going to explain it for you. Okay, so I was telling that how to correlate the stages and the grid. Now you all are clear about the grid, that how we talk about the grid, but currently we are not clear about how the staging goes. So if any point is -1, +1, or 0 on the grid, which means that if this portion is 0, +1, or -1, this means that it is a second degree prolapse. If it is -2, -3, this means that it is behind 1 centimeter. -2 is here, -3 is here, -4 is here. So whenever you will see on grid that it is written -2, -3, -4, anything like that, this will come to your mind that it is a first degree prolapse, because the second degree means 0, -1, or +1. If anything is behind +1, which means +3, +2, +4, this means it is a third degree prolapse. Let me show you. If it is here, +2, +3, +4, anything on the grid that is +3, +4, +2, that is in the third degree prolapse. So this is how we correlate the stages with the grid. Grid is basically the reading system, which means that you are just reading from the grid that how much is the prolapse. For example, if I talk about here, this means that the prolapse is at 0.0. So what 0 means is the interpretation or the staging. 0 means that it is like it is at the point of hymen. And when we talk about any point that is at hymen, -1 centimeter above hymen or +1 centimeter below hymen, this means it is a second stage. So this grid means it is a second stage of prolapse. Shaista, did I make it clear for you?
Yes, ma'am. Very clear.
Okay. So here you can see this is hymen. Again, you can see -1 centimeter and or +1 centimeter is stage 2. Anything that is further behind -1, which means -2, -3, -4, any point that is stage 1. And anything that is after +1, which means +2, +3, +4, anything that is stage 3. Now stage 4 means that total vaginal length -2, which means that if the total vaginal length is 10 and at least 8 centimeters is prolapsed, this means it is stage 4. It can be +8, it can be +9, it can be +10. So all of them come in procedentia. Okay, so is everyone clear about that? If there are any questions, I'm open to the questions.
Yes, ma'am. So kind of you, Jazakallah.
Okay, I'm really thankful for everyone for their patience and their presence here, and I will be trying to upload the things. Okay, a few people have just joined after the gap, like I can see 2, 3 people. Is everyone clear about the last things I just mentioned? If anyone is not clear, just mention in the chat box and I'll be happy to repeat it. And if everyone is clear, we are ending the session in a few minutes. Just to repeat the things, I'm just repeating the things a bit quickly again for you. Okay, so we had the points AA, BA, AP, and BP. P means posterior wall, A means anterior wall. So the first point A is -3, the BA is -3, AP is -3, BP is -3. This is C. This is usually -8, which means 8 centimeter proximal to hymen. And point D is almost -10. Okay, so this one, and then we had genital hiatus and the perineal body and the total vaginal length, but these two are not very important for you because they will never come. The total vaginal length is 10. Okay, so this we see here are the openings of the perineal body and the genital hiatus. Okay, and if we see the normal values, the A is -3, BA -3, AP, these are the normal values, and we showed them in the form of a grid. So these are the values that you need to remember so that you are able to classify it. Okay, so the people who are present here, just let me ask a few questions so that I'm happy that everyone is learning that. Okay, so if we have here and we have AA as -3, we have BA as +3, and all the values rest are same, only BA is +3. So what it is, can anyone tell it? Can anyone tell me?
Third degree cystocele anterior vagina.
Yes, very well done. It is a cystocele. Okay, and if I am talking about point C and point C is +3 centimeter, what does it mean? C
Can
is
you repeat?
+3.
C is +3 again. This is third degree cervical
It is a
descent.
3rd degree uterine prolapse. Very well done. Okay, so I hope I have made it clear for everyone because this is a bit like it is considered a taboo or it is considered a difficult concept, but in reality, this is a very simple concept. So if anyone is not clear about anything, just let me know so that I can end it. Okay, I'm happy. I think I have made it clear then. Okay, thank you so much, students, for your presence, and thank you so much for the patience because today the net was really bad. So if there are any questions, just drop in. Otherwise, I'm ending the session.
Thank you so much, ma'am.
Thank you so much. Thank you so much, everyone. Goodbye.